right, thanks, Charlotte. We're counting down. It's tight going from one session to the other. We have to set up, reconfigure our studio, but we're pleased to be here for this special session today at Teach to Reach 11. And we're very pleased to introduce our partner, Grand Challenges Canada, for this session on climate health risks and barriers. In fact, we're going to see, I hope that that we'll be able to bring in our partner here. Again, the procedure for those of you who've once you access the platform is you do need to reserve a spot before you can actually access the session. So we're looking for our partners from Grand Challenges Canada and looking. Okay, I see Maria Monzon from our team is also there. So a little bit more chaotic than usual getting started, but we're very pleased to introduce to welcome new partners to Teach to Reach, and very pleased to be welcoming Grand Challenges Canada. I'm going to ask Charlotte to share with us how and why Grand Challenges Canada is supporting Teach to Reach and supporting health workers around this challenge of climate change and health.
At Grand Challenges Canada, we are committed to learning from those who are on the front lines of health crisis. With support from the global technology company and the government of Canada, we are partnering with the Geneva Learning Foundation to ensure that the insights and lived experiences of the local health community guide our search for innovations that are tailored to the unique challenges of climate-driven health risks.
Thank you very much indeed, Charlotte. And we're pleased to welcome Grand Challenges Canada to the Teach to Reach family. We're going to dive right in with this first question to those of you who are with us in the Zoom studio. But if you're watching on YouTube, Twitter, LinkedIn, Facebook, wherever you are, I see Joseph Ngugi is now joining joining from Moronga County. So he's with us in the studio. All right, and we have some of the guests of honor for this session. Please raise your hand if you received the invitation as a guest of honor. We're looking forward to hearing from you. But first, to kick off, we have a question that anyone should be able to answer. It's really, how is climate change hurting the health of your community? So please, we are going to ask for our first volunteer for this session. Don't forget to introduce yourself. Before we go to you, and I see Mahesh. Mahesh, a warm welcome to you. Don't forget to introduce yourself and tell us where you're from, where and how you work for health, and then tell us how is climate change hurting the health of your community. And this is a question we've asked since July 2023 when we had the first special event on climate change and health. And it's always important to ask this question to understand from your perspective as a health worker what you are seeing, observing, experiencing. Mahesh, over to you.
Yeah, hello, Reda.
Yes.
Am I audible?
Yes, you are, loud and clear.
Yeah, so because I'm here in a very remote place in somewhere in Himalaya, so that's why I'm asking it repeatedly, because in my internet is not working well many times. So anyway, I am Dr. Mahesh Bhatt. I am a surgeon, author and public health consultant, working as a managing director and CEO of MMB SHS Trust. And it is a volunteer-based, volunteer-driven non-government organization, an NGO. And we are working on public health, climate change and health, and training the frontline healthcare workers, communicating health and health advocacy. So these are the multiple things we are doing. We are a regional organization. We are working in the Uttarakhand Himalayas. And so our problems are very much in line with this problem of the climate change. So today I am going to share with you a summary of a Himalayan story from the lens of a healthcare professional and an activist.
Yes, please.
So it is about challenging geography, economic and developmental activities, politics and climate change, creating a vicious cycle, skewing social determinants and issues of availability, accessibility, and affordability of healthcare and other social services, leading to multiplied vulnerabilities, you can say. So it may reflect the issues of 15% of the global population living in mountains. So it's not particularly true with our problem. It is true with the people, the communities who are living in the mountains, and it is about 15% of the global population, you can say. So this story has three actors: the Himalayas, one of the most sensitive and fragile ecosystem in the world; the outside world, its people and their activities; and the victims, the local population. So it's not only about the community who are they are living in the Himalayas, but it's also about the people who are not living there, but they are creating problems. They are creating the issues of the climate change, like fossil fuel burning, uh, a lot of other things, pollution, etc., and that is directly impacting the, what you call it, the climate in the mountains, in specifically in the Himalayas. So the frequency and severity of extreme weather events, flash floods, forest fires, disasters, and new diseases like malaria and dengue have increased in the last 2 decades due to tremendous human interventions and developmental activities with the climate change consequences. We are seeing a steep rise in tourism that is exploiting the local weaknesses to create business opportunities at the cost of the environment. So the built up area has increased in our area by 33% in the last 2 decades, and 60% of the construction is in unsafe zones and unplanned urbanization, which is hazardous to human health and the environment. We have lost 50,000 hectares of forest, creating tremendous biodiversity loss of human and wildlife conflicts. So why I am saying this, I am putting it in front of all the people who are listening it, that health is not only the responsibility of the healthcare professionals. It has got multiple sectors to get involved to get the better results. So it is creating significant economic and demographic imbalances and political and equity issues affecting the planning, allocation, and distribution of resources, and adversely impacting the social determinants of health, further forcing a lot of migration. They're further forcing migration from hills to plains. So the number of villages where all people have migrated has doubled in the last decade. So I want to attract uh, your attention towards it. The number of the villages where the all people have migrated has doubled in the last decade. According to the 2011 census, the number of such villages was around 1048, and in 2024 it is close to 2000. So we are advocating for health in all policies, and this approach is a solution. This is a solution. We are making it we are advocating it for as a solution to break this vicious cycle and turn it into a virtuous one. It is because in the mountains, people, communities, and their systems are part of uh, what you can say a fragile ecosystem, extremely prone to the consequences of climate change. If we keep health in mind while planning the policies, we have seen that it can act synergistically in solving issues and simultaneously help in creating favorable outcomes regarding sustainable developmental goals. That means making health systems and communities resilient and prepared and helping them to develop sustainable solutions. So there are multiple vulnerabilities. The vulnerabilities are multiplying because of the issues of the climate change in this area. And I want to make it a point here that the people living in the mountains, specifically in the hills of the Himalayas, their contribution to this problem, this problem creating the climate change is almost nil. So you can say their carbon footprint is very, very low. So, but they are facing this problem, which they never created. So that is my point. Thank you very much.
Thank you, Mahesh Bhatt, for this expose. We are really, so we thank you for your contribution. We appreciate, I believe you're amongst those who responded to the Teach to Reach questions, and we do look for that more comprehensive stories in the context of the live event. We have many participants eager to share their direct experience, things they have seen, what they have observed, and and their reflections on what this means. Before we go to our next speaker, we're going to look at the following. So we asked in 2023, in July 2023, we asked you 3 questions to kick off a survey, and we had over 1,200 responses. And this is going to lead into what we are doing in partnership with Grand Challenges Canada, and we'll be announcing for the very first time today at Teach to Reach 11 and inviting a select group of Teach to Reach 11 participants to join. So we asked you 3 questions. First of all, we wanted to know, as health professionals, what best describes your relationship to the community. And you can see that most of you consider yourselves to be part of the family. That's over half. And then if you add those who are trusted friends of the community, we're over 4 out of 5. And then we ask you this. Climate change is a threat to the health of the community I serve. That's what we said, and we asked you to say, well, do you strongly agree or strongly disagree with that? And you can see that most of you gave it a very high or even the highest threat level. And this was 1,234 respondents, both French and English speakers. So from, I believe, from 68 countries, if I remember correctly. So this was in 2023. We also asked you to what extent individually as a health professional you worry about climate change. And you can see here again that same threat or worry scale from 0, no worry, to the highest level, and you can see most of you actually assigned the highest level of worry to this question. So that is why we want to open this session as we welcome Grand Challenges Canada to the Teach to Reach family. We have an exciting announcement that we'll be making together. We want to open with this question: how is climate change hurting the health of your community? And of course, let's be careful here, because malaria, heat stroke, asthma, malnutrition, waterborne diseases, many other afflictions are not new, and all of them can happen in the absence of any change in climate. So I'm now going to turn to Charlotte to lead us to our next speaker.
Thanks, Reda. So I'll be inviting Kaiser Haria from Saudi Arabia. You indicated in the chat that you like to speak, so over to you. And please do start by introducing yourself.
Good evening, everybody. I am Dr. Kaiser from Saudi Arabia, team leader and physician working in Ministry of Health. I am audible. Are you listening, Charlie and
loud and clear?
Yes.
I am working as a team leader and physician in Ministry of Health since from 20 years. I am one of the part of the National Tuberculosis Control and Prevention Program. Regarding climate, I suggested the government here in first I will introduce. It's I am from basically India. Nationality is India, but working as a resident in 20 years from MOH, as I told before. What is harsh climate is here is a very harsh, hot climate. The whole world knows desert. It is a big desert, Sahara desert. It is passing through Saudi Arabia and Middle East countries. So patients usually come to me as a dehydrations. It's stroke, sunstroke, dehydration, malnutrition, and a lot of other bronchial asthma aggravating factor. Lot of the other things used to see. And used to go from government deputation to Hajj and Umrah. Millions of people coming to there. They have to walk a long distance to perform the rituals. During this, a lot of patients have seen sunstroke. They fell down and they got paralysis also. Lot of complications happening. So I suggested the government now to make a green plantation around the whole Saudi Arabia. From the north, south, east, west, so that it increases the afforestation, desertation support, and increases oxygen concentration, and increases the health condition also, and carbon also, industrial waste products, everything it will be supported. and moreover, there is a no rain over here. So if you put the grand plantation, if trees will grow up, then rain will also come, clouds will formation. These are the benefits for the health. If oxygen is important, purification of oxygen. If anybody will take the inspire the pure oxygen, it will detoxify your body, and everything carbon dioxide will out from your body. So oxygen is very important, pure oxygen. So I suggested this. These are the worst conditions I have seen since from a long time. So I suggested the government. Government is an approval. We need a funds. So we are waiting for the approval from the government and funds, Dr. Reda. These are the this is the things.
Thank you very much indeed, Kaiser Harirar from Saudi Arabia. Let's keep going. We have people who are demanding to speak and who have important, I believe, experiences to share. Every experience that you have as a health worker facing what you think are consequences of climate change and health that matters. Charlotte, who shall we hear from next?
Okay, so Reda, I don't know. Can we try Andrew Nina again? Your hand is raised, and we really want to get to hear from you today. I also saw a comment from Shitu in the chat. Okay, and I see you're unmuted already. So over to you, Shitu. Are you able to share, to elaborate more?
All right, thank you very much. I'm Salahuddin Mohammed Shitu, a social worker and a community development expert. So we had, I'm trying to share the kind of the experience that we had 2019 with the flood that we have in such a region in our community. So those flood has really taken so much of our pregnant women. They can't have access to road, and they end up like losing. Most of them lose their life due to bad road, due to the flood that we had. So, but for we collaborating with the local transport authority, they really kind of like help us and see how we can move these women. So, but most important part of it, so by through the community engagement that we had and showing them that sense of belonging, so we now have a way that we construct a kind of semi route that is going to lead us to that primary health care, so which we have kind of really succeed in doing that. So I think climate change has really made difficult impact in most of the vulnerable pregnant women and the children. But right now, my NGO, we are really working on how we can have those elderly women and the pregnant women, so that they can have access to clean water, and that is the most important aspect of the challenges that we're having at the moment due to the climate change that we have in this. So that is just what I want to share in a nutshell.
Thank you, Shitu Salahuddin, for sharing. Before we go to the next speaker, just to give Charlotte a minute to line that up, we're building on questions, Teach to Reach questions. You can see the format they came in by email. So these are sent to everyone who requests the invitation for Teach to Reach 11. And each time the questions, well, some are similar. This is not the first time we're asking about climate change and health, but we certainly have not exhausted the topic. And so you receive the questions in the weeks preceding the Teach to Reach event. And you see the little blue links. You just click on them and you're able to answer a range of questions. We asked you about a range of things, so you can see what we ask you and why it matters. And you can see here that with Grand Challenges Canada, will be hopefully the Grand Challenges Canada representative is on her way. We'll be introducing the partnership and making a very exciting announcement. You can see the first question is to tell us about trying to protect people's health from climate problems, but running into into barriers, running into problems that prevent you from doing what you'd like to do to protect people's health, sharing experiences of extreme weather making it hard to provide healthcare, for example. And so, of course, feel free to still answer to speak to the first question, how is climate change hurting the health of your community? But we're most interested in the barriers. So tell us about something you are doing to try to protect people's health from climate-related problems, but you are facing obstacles. So back to you, Charlotte, for our next speaker. And of course, if you're a guest of honor, you shared an experience, and that is what we'd like you to share. Please keep in mind there are many, many colleagues who also want to share their experiences. Over to you, Charlotte.
Thank you, Reda. And I just wanted to say a warm welcome to Joanna Sanchez. That is from our partner GCC. That's in the panel, Reda. But we have Gifty Akosua that is unmuted. So Gifty, we want to hear from you. Gifty, are you able to hear me? I could hear you earlier on. If not, we'll turn to Margaret Nabagala.
Thank you very much once again. I'm Margaret Nabagala from Uganda. I'm one of the guest speakers today in today's meetings. I'll try to be brief. Climate change in Uganda these days, a lot of rain has caused a lot of changes. I spoke earlier about the increase in malaria cases because of the mosquitoes bleeding in these, a lot of water, just into the potholes in the roads and, that kind of thing. And covered. And then other than the malaria, recently we had a very big hit. We had a lot of, lives. We lost a lot of lives, up to 82 people dying because of flooding and because of soil erosion in eastern Uganda. Eastern Uganda, you must have heard about this. 82 people's lives were claimed because of soil erosion and flooding. Homesteads were flooded and covered with the soil, and many people. So they had to bring these, I forget the way they call them, but they were digging up, dead bodies out. I'm sure many of you heard about it. So that's part of climate change. When there's a lot of rains, the climate has changed and many things come out, and we are losing a lot of lives because of that. Thank you very much,
Margaret.
So Chair.
Can I ask you to tell us more about what you did in response to this? What did you do, and what were the barriers? What obstacles did you face trying to protect people's health in this situation?
The government has helped a lot in this, because earlier on we had also some soil erosion sometime, and people were told, the government made arrangements to transfer people, to relocate these people. Although some people stayed in those, when people are used to their locations, they really feel challenged changing from one place to another. But still today, the government has really called upon people, those who have remained, at least the survivors, to relocate. They are trying to plan new areas, and they are compensating, getting them some, because so many things were covered. Their household items were covered with the rains and flooding and the soil. So government is planning to give them some compensation in terms of cash, and to build them houses somewhere where there are no such things, such happenings. Because these people in the eastern, they are mainly located there are a lot of hills and mountains. So when they live into these mountains, when there's a lot of rains, the mountains start, the soil start going and going down, and the trees are washed down, and they go and cover people who are down, and those who stay in the lower ends. So the government is looking at helping these relocate, and maybe that place can be used for some other things like growing agricultural products and that kind of thing, so that we don't lose just the areas like that. And we are trying to also try to help educate the public on radio stations and also in the community gatherings about not constructing houses in mountainous areas, especially those which are risky. So That's how we are doing about it. Yeah, and also the roads. Somebody I mentioned earlier that roads have been really damaged, and of course the accidents increase because of the potholes and that kind of thing. And we are facing a lot of trouble, and also with Maria, which has increased tremendously. So that's how we are facing these days in Uganda with climate change. Thank you very much, and over to you, Chair.
Thank you very much indeed, Margaret and Nabagala from Uganda. We are going to hear from one more person, and then we are going. I'm really pleased that Joanna Sanchez from Grand Challenges Canada has been able to join us, and we're looking forward to introducing you, Joanna, and asking you some questions about why and how Grand Challenges is supporting Teach to Reach, and beyond that, seeking to support actors, stakeholders who are trying to respond to climate change impacts on health. So, Charlotte, back to you for our next speaker, and then we'll go to Joanna to introduce our partner.
Thanks, Reda. So, Hydre Mohammed, and I know that we are having some glitches on the platform that is adding some characters to your name. So, if I pronounce wrongly, just forgive me. Mohammed, your hand is raised, has been raised for quite a while. Are you able to unmute yourself and speak to us? If not, we are going to turn towards
we have
Adamu.
Ihe Jirika.
We'll try
Onye Nonachi, who's also unmuted. Are you able to speak to us? All right, we'd love to hear from you. And it's always, this is perfectly normal. It's amazing, remarkable that across so many countries, over 70 countries, we're able to connect in this way. So just asking some of you who, yes, Fatoumata Sangare, Alima Alkamis, voices we have not yet heard, I believe, at Teach to Reach. Nathaniel Muller as well, Omolara Adeyemi. We'd love to hear from you as well. You have been, okay, and I see Marta Trainer has to unmute. Fatoumata Sangare, Ihe Jirika, and Hydri, are you able to speak to us? We'll see. It's always a question of who's able to figure out. Yes.
Hello, Leda.
Yes. Who's on the line, please?
Hello, Reda.
Okay.
Hello?
Is that Halima?
Yes, Reda. I'm Halima Usman Al Khamis. I'm actually on a journey. That's why I can't really speak much because of the interferences.
Okay. All right.
However, I posted in the chat bot some of the complaints, some of the challenges we had as a result of climate in Yobe State. Sometimes earlier around in June, July, August.
I see.
We had series of floodings across almost 5-6 LGAs. However, the most devastating one occurred in Nguru, LGA. However, in brief, what we did was actually to help people was to actually intensify the IT, and that's insecticidal treated nets to people, and then to camp them in some located places around the LGA, so that they will not, because people were devastated, houses were lost, and you had to now even look out to people on even what they had to eat at during those period of time. So while we had series of cases of malaria and some other skin diseases that were erupting as at then, that we had to hospitalize and even take care of their hospital bills as at then. The government actually did a lot to see that people were lives were not lost. However, it was unfortunate to have lost 2 lives as a result of boat capsize. Two people actually died, and it actually was something to write home about. Immediately after that incident, we now had that of Maiduguri State and we had Borno State, and we had to even shift our semi-emergency response to Maiduguri for that rescue.
So Alima, can I ask you one more question? I understand that it sounds like you are at work. I'm going to try to ask you one more question. It's an important one, and it's the basis for why what Grand Challenges Canada is particularly interested in understanding in the situation you described. So with a flood and with this upsurge in malaria and other problems, you, of course, as a health worker, did, I'm sure, everything that you possibly could. What prevented you from doing what you wanted to do? Can you think of one example, something that was a real barrier, that if you had something to get through that barrier, you could have done much more to help people recover from the flood and to deal with the health consequences in particular? Can you think of a specific barrier that prevented you from doing what you wanted to do?
Okay, one specific aspect of the rescue was because the water was so much we couldn't get access to electric boats. So what we did was we actually used the local boats available in the community, and that actually slowed rescue, especially in terms of people that were blocked in their houses as a result of the flooding. But however, it was actually a successful mission as at then, and we rescued a lot. And I'm sure if we had access to electric boats as at then, it would have been easier and things would have not gone the way they had. It had to.
Okay, thank you so much, Halima Usman, and thank you for taking time while you are, I believe, in service to share your experience. All right, we're now.
Thank you, Ida. Thank
Halima,
you, Charlotte.
One last question for you, if I may. What would you be looking for from your colleagues? Is there any specific question that you would have about how they faced, for example, recovery from a flood and the health consequences of that? What could be most helpful for you to hear from colleagues about?
Well, it will have been. I will actually like to ask people to know how. I don't know. In UB, we have a kind of rescue team that that was late. So, but I don't know how is it possible for us to have even have an earlier rescue than what we had as at then. If it is possible for people to share experiences on how they had to have an early, because I know if we had an earlier rescue, that's from the early warning sign of that flood, people would not have suffered the way they had.
Understood, Halima. So looking for Teach to Reach participants with experience in strengthening the preparedness and the speed of response as well when a climate-related event like this flood that you experienced and the other floods that have happened in Nigeria since takes place. Thank you so much, Halima. We're now... All right, so that's we've heard a series of compelling stories. Really appreciate those of you who are taking time while you're in service to join. We are now going to properly introduce our partner, Grand Challenges Canada. A warm welcome to you, Joanna Sanchez. We're going to ask you to unmute. Yes. Oh. Yes, please go ahead.
Hi, Redan. Hi, everybody. So happy to be here. So I've turned my camera on for a second. So I represent Grand Challenges Canada. For those who don't know Grand Challenges Canada, we are a Canadian-based organization, primarily funded by the Canadian government, but we partner with funders and organizations all across the world. We are focused in global health and humanitarian innovation funding. And so we fund local solutions to some of the greatest challenges facing global health and humanitarian context. And what's really interesting about Grand Challenges Canada is that we fund through a Grand Challenge model system, which means that we identify what are the greatest challenges or what are the critical barriers. So you'll hear Retta talking a lot about the barriers, and that's because we're very interested in what is it that is preventing us as a world, and specifically you that are at the front lines of these health issues in low middle income countries. What are the barriers to overcoming these health challenges? And so we fund solutions to those barriers. And to do this, we must identify what those grand challenges are. And so we are embarking on developing a climate and health funding program all across the world. And in order to do that, we need to identify our climate and health grand challenges. Now, we want to do things a little differently from what's been done in the past and potentially from some of the other funders, that we really want to take the questions to those best placed to identify the problems. And those are the people at the front lines of this climate crisis. And so, and that's all of you. And that's why I'm so happy to be here listening to some of those challenges that we're facing. The climate crisis is a global one. However, it's disproportionately affecting those countries, regions, and places that have contributed the least to climate change. And we're very aware of that fact. And so that's why we want to bring local healthcare workers and the health community, scientists, epidemiologists, everybody to the table to tell us what are the biggest priorities that you're seeing in your region, number one. So is it malaria? Is it flooding? Is it, what are the challenges? Is it heat stress? And then what are the barriers to overcoming those challenges? So we are going to be launching a survey with the Geneva Learning Foundation that I'm sure Rada's spoken about. And then we're going to be launching this beyond the Teach to Reach group, also to all our partners around the world. So everybody's partnering with us on this because we have a lot to gain. And so we are asking everybody to please participate, share within your own networks. We're wanting to get as much information as far and wide from locals. We don't want this to all this information and data to come from the global north. We want it to be the people at the front of the action and those involved in health action. Actually, it just came up on that slide there. And so I'm thank you for all your inputs. The climate crisis is not only creating new challenges. I've heard a lot about flooding here today, which is of course a massive challenge. We have wildfires, we have all types of storms, but we're also seeing that, and Rada mentioned this earlier, is that it's worsening existing challenges. We already are concerned about mental health and malaria and dengue and malnutrition, and climate health is just making all of these things worse. So we're going to be asking everyone, what is it that you're seeing that's the biggest challenge in your region? And again, the barriers. So happy to be here again. I'm Joanna Sanchez. I myself, I'm an epidemiologist and public health scientist, so I'm very passionate about this. And so thankful to be here today. And hello, everyone.
Thanks so much, Joanna. So, of course, we have some questions. So, first of all, as you know, Teach to Reach, there are, of course, many health workers in very different capacities, pretty much every job role, every system level. There are also organizational leaders who are looking for opportunities, looking for funding, resources to support the response that they're mounting to the challenges that they face that includes climate change impacts on health. Can you explain in 2 or 3 sentences how Grand Challenges work? What is the chance that a local organization, a small organization, a community-based organization could actually apply for and win secure funding from Grand Challenges Canada to do work that they consider is critical in their community to respond to these climate change impacts on health?
Thank you, Rada. Yeah, so as I mentioned, that this is going to help guide the new funding program that we're developing. We plan to launch that in early 2026, so sometime between January and February, March 2026. And this is going to be according to the results of this big landscape analysis that we're launching. This will be open to every country, every low middle income country. Unfortunately, if working in Europe or North America or Australia does not qualify, it has to be a low middle income country. We very much like centering local organizations that has innovations. We're looking for innovation. We're looking for big ideas for big problems. But we welcome everybody to apply. We will have, and if you would like more information about that, we invite you to subscribe to our newsletter, because we will be hosting closer to the date webinars in terms of how you can apply. The first step is, of course, contributing to the landscape analysis so that perhaps, you know, your greatest interest area could be selected as the priority for your region. We might actually be doing regional grand challenges if it turns out that the different regions of Africa and Latin America and Asia are showing different priorities. We might actually fund at the sub-regional level even, or perhaps continental. So stay tuned for that, but which will give different opportunities, of course. So there are ways to engage with us and join webinars and workshops to help guide the the application process, we hope that there will be many rounds. This will be a multi-year program. And so if you're unsuccessful the first round, we hope to launch another one the following year and then the following year. So there'll be a lot of opportunities there. And the other thing I didn't mention is the results of this will also be published as a public good document, open public access to the world to help NGOs and policymakers and other funders and researchers, and hopefully help guide some priorities. So we hopefully will have two big outcomes come from this big undertaking.
All right, thanks,
So
Joanna.
more than 2 sentences, Retta.
right. So yeah, second question is why you're going through the process of doing this survey with and starting actually with the Teach to Reach network, as well as many other networks that will be engaging in this survey next year. Can you tell us why you chose to do it this way? You said it was a little bit different. Can you tell us more?
Yeah, so the first part of this, the last 6 months essentially, was speaking to partners, other funders, organizations, local organizations too. And a lot of things came out of those conversations is that climate and health is quickly evolving, and people are very much wanting to put financing into the space, which is absolutely important. But in order to move quick, they haven't been able to properly engage local communities as much as they want. But there has been some local engagement. Of course, it hasn't been as wide scale as we would like it, because we would like as much input as possible. So one of the things that came out, and I was actually in speaking with some of the local organizations, where I was most impacted, where they said, no one is asking us. We are here. We are seeing the challenges. We are experiencing them. Ask us. Bring us to the table. You don't live this experience like we do. Give us the opportunity to provide input. So that really impacted us. We do try to engage local communities as much as possible, and we did that in our last Grand Challenge. However, it takes time when we do this at a face-to-face level. We can only do a few countries. This way, through an online virtual platform, such as Teach to Reach, where we're able to connect with so many people, but then we're also, with a survey, we're able to tap into massive, large networks, such as the Teach to Reach that the Geneva Learning Foundation leads, over more than 60,000 healthcare workers, and of course, many other partners that we're launching this with around the world, gives us more people that we can reach at the local level, those experiencing those challenges. So that's the why. That's why we really did want to bring that to the people and make this a participatory research exercise.
Thank you so much, Joanna Sanchez from Grand Challenges Canada, who's leading this effort of Grand Challenges Canada to listen and learn with those closest to the communities being hardest hit by the impacts of climate change on health. We're very excited to be working with Grand Challenges and to be partnering to develop and share this survey, asking each of you as health professionals, as members of the health community, what you are seeing, what is your perception of what is changing in climate, what is changing in health, and what barriers to action that you see. And in fact, we're very excited today to be formally announcing and launching the pilot of this survey, only exclusively for Teach to Reach participants, for those who have responded, who've contributed to this particular session and theme. We'll be reaching out to you, inviting you to help us test the survey to make sure that it makes sense to you and that you can see how it serves your needs. As you know, at the Geneva Learning Foundation, if we ask you questions, if we ask you to complete a survey, we make sure, and we're doing this very much with Grand Challenges Canada together, we make sure that your responses, your insights, your experiences are given back to you, as well as those of everyone else, so that it can serve your needs. Thank you very much indeed, Joanna, and we're very excited to be launching this together. And we're now going into the second half of the session. I've been showing on screen some of the questions that are in the survey. I'll go through them now. First of all, this is aimed at the health community, so we're most interested in those whose voices are seldom heard or infrequently heard, even though they are greatest in numbers, and that is community health workers and others who work at the community level, directly observing these impacts of climate change on health. So we'll ask you questions about that. They're really the core questions are: what changes in terms of the weather, but also the climate. Which ones have you observed in your community? Which health problems do you think have gotten worse due to these changes? And then we ask you, as Joanna explained in the Grand Challenges approach, just focus on barriers, because if innovation, new ways of doing something are going to help, they need to be focused, aimed at the barriers to health action. So we'll ask you about those as well. And then we'll also ask you specific questions about the barriers in the community. So when trying to get your community to understand and act on climate-related health issues, what is the main area that you face? And in fact, I suggest we go there, going back to Charlotte, and inviting you, especially our guests of honor who have already contributed their experiences. Would love to hear from you in the remaining time of this session to get a sense of what community barriers specifically you see with respect to health action. Can you think of a time when you tried to get your community to take action on a climate-related health risk, but people were resistant, they hesitated? If you can tell us what exactly happened, how did people respond, and what did you learn from this experience? So we're going to open up the microphones if you'd like to raise your hand. Otherwise, we'll go back to some of you that we know we're ready to speak. If you do not have anything specific to share on this question, that's fine. We want to hear your voices. That's what this session is about. And this time, in this particular session, okay. If you have questions about grand challenges, how to access funding, or you want to express the need for funding, this is not the place to do it. So really, we invite you to share your specific experience of what you saw, of how the community is responding, making sense of these issues. Let's go to Charlotte. Who shall we start with?
So I'm inviting everyone. You have the possibility to unmute yourself. So please go ahead and unmute yourself and share. Respond to any of the questions, any question of your choice.
And we're particularly interested in hearing from people that we haven't heard from yet.
So people we have something to run about.
Benjamin, are you able to hear us? And we have...
No, that's what we are using.
All right. Let's go to Hassan Mohammed. I think you've tried to speak before. Hassan, are you able to speak to us? Usman Mohammed Tukur, same question. Imam Wada.
Hello.
Yes.
Usman Mohammed Tukur. I know you tried to speak before and couldn't, so I'm glad you figured out your microphone. We're listening.
Exactly. Thank you so much, Reda, for giving me this opportunity, and thank you so much, Charlotte, for this kind of wonderful series of events. I actually appreciate this kind of gathering, and I learn a lot of it. So actually, my concern in our community concerning this issue of climate change, some of the barriers are there's lack of sanitation in our areas. That sanitation is really matters. It used to block a lot of water passage, which when there is a heavy rainfall, it will cause a lot of damages, like flooding, like weathering and other things. But people don't understand. So there is need for us that we are working in the health sector to mobilize, sensitize people at the community level to know the importance of this sanitation, so that if there is any disaster that is coming to our community, it will be at a minimal level so that we can be able to manage it. That is one thing. And another thing, issue of this awareness is very, very key. We should look for a way. We are trying to look for a way to see how can we leverage with the state level, LGA level, and the community level to make very strong awareness group or awareness system that mobilize our people to know the importance of this climate change. People are taking it for granted, but it really affects our environment, our community, our even health. Thank you so much, Ryder. I really appreciate it.
Thank you, Usman Mohammed Tukur. Of course, we have questions for you. So first of all, you can see on the right-hand side, are you able to see, I don't know if you're on your phone, it might be a little bit too small. Can you see the right-hand side? Can you read the text in the right hand?
Yes, what is the main type of barriers you face when dealing with the health issues caused by climate change in your area?
Sorry, I actually meant the right-hand side when trying to get your community to understand and act on climate health-related issues. So you have a list of 12 items. The last one is just that the main barrier you face is not on this list. Can you pick out which one is closest, is the best fit for you? If you had to choose only one, what is the biggest barrier when it comes to the community?
Actually, the first one, people do not believe climate change affect their health, because there is need for the people to know even what is the climate change, how is it related to their health. Typically, example now, if there is lack of conducive environment, lack of sanitization in environment, there is a lot of blockage which give mosquito shelter that can breed to cause a lot of malaria in the community, and malaria is seriously affecting our health through even though like a pregnant woman, they used to experience such kind of malaria in pregnancy, but people doesn't know that malaria is related to their climate change. So that this really affects our community, and there is need for us to do a lot of sensitization to mobilize people to know this issue of climate change is related to our health. Thank you.
Thank you very much indeed, Usman Mohammed Tukur. We have some comments that go in the same direction. We should put it as our first priority, creating awareness to community people. That's Andrew Fanina. And then Lucy Adebayo says lack of awareness. Charlotte, over to you. We have time maybe for one, possibly two, if they're really concise and get to the point. Speakers, before we close this session, and we'll be going into the networking session, which will be the last part of Teach to Reach 11 for English speakers. So back to you, Charlotte.
Thank you, Reda. So we have Taban Anthony Stephen. Your mic is already unmuted. We haven't heard from you since morning. I hope we get to hear from you clearly now. Taban Anthony? So unfortunately, I'm inviting Onye Nunachi. You're unmuted. Onye Nunachi, your hand is raised.
It has been raised for a long time, and I think we tried before, so I'm guessing that they're having an issue. Adamu Gamawa?
Yes, sir.
Okay. All right.
Hello, everyone.
Warm welcome to you. Don't forget to introduce yourself, and maybe you can tell us, yes, what experience you'd like to share in relation to climate change and health.
I am Adamu Gamawa from Center for HIV and STD Research, CISTA, from here, Bauchi State, Nigeria. One of the challenges we are facing here, climate-related health risk, is deforestation. We understand that one of the reasons we are having most flooding here in this part of the country is as a result of deforestation, cutting down of trees. People are cutting down trees in mass, looking for source of energy to make firewood, to make charcoal for cooking purposes. And that is making the environment so susceptible to flooding. I think it's one of the reasons we are having more water accumulated in the community, which is breeding mosquito and is causing, is giving fertile environment for mosquito replication. And that is causing a lot of malaria spread in the community. So I think deforestation is one of the, is like the source of the problem of flooding that we are facing here. People have to cut down the trees because they are looking for source of energy to cook. And mostly there is no alternative but the bush, the available bush, to go and cut down the trees to make charcoal and make firewood. And that is excessively putting the environment at high risk high risk of climatic changes.
Adamu Gamawa, of course, you work for health, but can you tell us how you know this and what makes you think it is related, it is caused by climate change, these changes that you're describing? You describe the causal chain in terms of the change in weather patterns, then leading to ultimately to more malaria. But what makes you think it's climate change? Is it just your opinion? Is it because you know this is happening globally, you've read about it, or is it more than that?
Yes, it is known that destroying the bush can affect the climate, can cause climate dynamics. And it is known in the community also because there is a lot of awareness going around. People are being told to stop cutting down the trees because that is what is responsible. But there are many scholars and the media that are advocating, that are de-emphasizing that this cutting down of trees is the cause of the climate change here we are facing. So I'm not the only one here. Like the community themselves know, but it's like they don't know what to do. People don't know what to do, and there is no. Hello?
Yeah, so in your case, it is not, your perception is not that the community it needs more awareness. They have the awareness, but they don't know what action to take against deforestation and its consequences. Is that?
Yes, exactly. It is an ongoing discussion.
All right, understood. Well, believe it or not, we're already out of time for this session. It feels like we've just barely gotten the discussion started. Now, for those of you attending Teach to Reach today, or those of you who are part of a Reach network, look for the follow-up, the invitation to complete this survey from Grand Challenges Canada. Really a unique opportunity to make your voice heard, to make your observations, what you see because you are there every day, heard by Grand Challenges Canada and other global partners that are trying to figure out how to best target limited resources to support change on the ground where it matters most. We'll read a last quote from Fatoumata Sangare. From my own knowledge, and which is well known as a fact, climate change can cause abnormal increase in rainfall, leading to an increase in mosquito breeding sites, a target for the occurrence and increase of malaria cases. Yes, that does seem logical. We always ask you, how do you know that? Why do you think this is true? And that is how we get at the basis for what you believe to be true. Okay, we have more changes coming in. Barrier to climate change interventions, says Gregory Argogo, are at the global levels, which the government is trying to address. But there are more serious barriers at the family or homestead level. Issues like malaria, diarrheic diseases. This is the level where community mobilization is most important. Every time we've discussed about this topic, we get unique insights from this community. We want to thank Grand Challenges for its support to the Teach to Reach event today, as well as Teach to Reach 12 that'll be coming up in March. We'll be continuing this discussion, and you can also engage, make your voice heard by responding to this survey that will be coming your way, asking questions about climate, health, risks, and barriers. Once again, thank you and goodbye. Now, just to look at what's happening on the conference platform, we have the next session, and this is the final session of the day. Where did it go? Okay, starting soon, right in front of my eyes, is the networking session. So remember how the Teach to Reach conference platform works. You first need to reserve a spot. And then you can see the join button. If you're just watching in the lobby, so you're watching this right now, you won't be able to meet, network, and learn at all. You'll only be able to see, maybe there'll be a few people in the room, and that is those are the ones that we'll be speaking with. But the real opportunity is to go into this meet, network, and learn session so that you can actually do that. It does require changing from this Zoom room, going back to the lobby, and then coming back in for this session. So we'll see you. We have 2 minutes to get set up with Charlotte and Maria. We'll see you soon.